Welcome to Mountain Health Today. I am Ted Owens, your host. This program is brought to you by the Tahoe Forest Health System. And as always, we are talking with Mr. Harry Weiss, President and CEO of the Tahoe Forest Health System. Our topic today is the Tahoe Forest Health System Foundation. Harry, good to see you. Welcome back. And I know that this is one of your favorite topics to talk about.
Yeah, it's a very positive, amazing topic to share, and hope it'll be encouraging to everyone that sees it.
Before we get into it, Harry, let's go back and talk a little bit about history and the wonderful gift of a gentleman named Mr. Dick Joseph.
Yes, Dick Joseph, he and his wife were expecting twins, and with deep regret, as he was here in the Truckee area, there were no obstetric services in Truckee, and so they rushed to Reno for delivery. It was a complicated delivery. His twin daughters were born successfully, but with deep regret, his wife passed at the birth of their twin daughters. And Dick Joseph did a very kind act. It was a very therapeutic act for him. And I really emphasize that because all of us need therapeutic experiences in our life from time to time, and hopefully not related to this specifically, but he chose, rather than becoming introverted or reclusive, he chose to donate land in the area of Truckee, in the gateway area of Truckee, for a hospital that could deliver babies and provide other valuable services. And so he did this back in 1951, and that really started to propel community individuals and other actions that really started healthcare here in the Truckee area. What an amazing saga. And as he did that, it's really hard to imagine the thousands of patients' lives that have been saved over the decades to date. We're over 70 years of age today, and the decades that will still follow.
Harry, this is an incredible legacy that he leaves, and I know he gifted more than that later as well. He was a very philanthropic human being. But let's talk a little bit forward. Let's talk about today, because the health system has not one but two foundations. Why do you have two foundations? Share with us how that works.
Great. We have a large geography here in the Tahoe Forest Health System. We serve dominantly at least 3 counties and portions of 2 states. And healthcare is very vital in the Incline Village region, and it's also very vital in the North Lake Tahoe Truckee region. Tahoe Forest Hospital was the very first healthcare provider serving the entire Lake Tahoe region. Barton Health came along second, and Incline Village came along third. And so donors in each of these regions, really are very caring about sustainable healthcare within their region, because timely access, again, to great healthcare when minutes and seconds counts, again, is the most precious gift on this earth. And so that's why there is typically a focused area of donations based on residents based on the areas that they live in. And we found that it really meets our donors' needs to have foundations for Incline Village Community Hospital and a foundation for Tahoe Forest Hospital and its related activities.
Harry, one question that people very often have with respect to foundations is how much of their dollar goes toward administrative charges or costs, and how much actually goes to make a difference. How is that managed with your foundation?
This is a huge difference versus nearly all other competing foundations out there, and that is that 100% of every donor's dollar, restricted or unrestricted, goes to purchase new equipment, facility upgrades, those kinds of things. Not one penny is spent on administration of the foundation or administration of any of our hospital activities. All donor dollars go to improve equipment, facilities, or programs.
And Harry, we are going to talk a little bit about some of the campaigns that the foundation engages in. Just real high level, what type of activities does the foundation promote to connect with potential donors?
We have a variety of community activities that donors can participate in. We also, if you've been a patient at Tahoe Forest Health System, we try to connect with you and partner with you. We want to hear from you if you're a grateful patient, for example, and provide opportunities to build friendships and to donate that way. We do send out notices of key activities that are going on in the health system to homes within our region. So we have many notices that go out to our region sharing the positive changes that are going on and giving the opportunity for families to become friends and to participate in accelerating the forward progress of great healthcare in this region.
So Harry, we've been talking about your Tahoe Forest Health System foundations, and in a moment we're going to talk a little bit more about the continuance of wonderful philanthropy, the legacy of Dick Joseph, for example. And we're going to step away in a moment and then come back and talk about the Annalise King Hall Fund. Very much look forward to that. You're watching Mountain Health Today. My guest is Harry Weiss, President and CEO of the Tahoe Forest Health System. We'll be back in just a moment. Welcome back. You're watching Mountain Health Today. I'm Ted Owens, your host. And we're speaking with Harry Weiss, President and CEO of the Tahoe Forest Health System. And today we are talking about the Tahoe Forest Health System foundations. Harry, you shared with us a little bit of history about the philanthropy of Dick Joseph and his gift of the land that the health system hospital is on. But there are great acts of philanthropy that continue to this day within that legacy. But before we go there, it's important for folks to understand how the foundation is run and what its structure is. Can you share with us what that looks like?
Yes, this is a very important point. We have caring community individuals who are donors within our community, and at Incline Village Community Hospital Foundation, we have a nice array of community members who are active donors, believers in sustainability of healthcare. We have one executive director of our two foundations, the one at Incline Village Community Hospital Foundation and Tahoe Forest Health System Foundation. And so it's just so important to know that we have caring community-based donors who are the board members of each of these two philanthropic foundations. And they are the ones that review and approve the projects that come forward that are critical needs in the Incline Village region, in the Truckee and North Lake Tahoe region, and they, in concert with the donors' wishes, really review and approve the monies that then come to the health system to make a real positive difference for healthcare for the future.
Thank you for making that point, Harry. I think it's wonderful, the gift of time and effort that they give to the community. Now we're going to talk about the Annalise King Hall Fund. And this one is very, very special. Share with the folks at home what it is and who Annalise King Hall is.
Yes, I think as I share this, you'll see a little bit of a thread relative to Dick Joseph. With deep regret, Dick Joseph lost his wife at the birth of their twin daughters the parallel with Josh and Lindsay Hall is with deep regret. They had a child that was born as a stillborn, and they too exhibited the kindness, that therapeutic outreach that Dick Joseph did many decades ago, and really began to develop the Annalise King Hall Fund. And they've stayed active and engaged with us every year. And their first very positive act is really to lay the groundwork for supportive services in the event there is fetal demise. It's very traumatic for staff, physicians, and so forth. And how can we have the most evidence-based program there? And then it has progressed from there.
And in addition to that, the fund is designed to help families that may experience the same thing. So it's staff and, of course, families.
That's absolutely correct. It was a program to really help those moms and dads who had an experience just like Josh and Lindsay Hall. In addition to our caregivers, you make a very excellent point there.
And I think in this day and age, I think it's so precious that somebody can go through a tragic situation like that and turn it to a positive. Harry, they challenged the foundation a little bit as well with a match program. Share with us what that looks like.
Right. We had recently a Giving Tuesday campaign where the Halls indicated that they would provide a match. We had an exciting array of donors that became active, and we were thrilled with the amount of combined monies that were provided, and we were able to purchase a neonatal resuscitation device for our Joseph Family Center for Women and Newborn Care, which is an amazing device to really help provide resuscitation should there be an infant who's struggling a bit.
It's an advanced piece of equipment. How does it work? What does it do?
Basically, it really provides a very customized, sophisticated resuscitation service just for newborns. And again, it's a positive pressure ventilation tool that helps make sure that you have very consistent, high quality respiration assist and or cardiac heartbeat assist. And what also came with it is specialized training for our staff so that you have ideal, consistent resuscitation practice on an infant.
Harry, in addition to all of that, funds also go to area of greatest need through Team Member Giving Fund. And I know that this led to the purchase of a Lucas chest compressor. What is that? Why is it important?
This is an important CPR tool for strong, steady, high quality, properly located chest compressions of the heart for older children and adults in the ER, med-surg, and ICU departments.
Thank you, Harry. We've been talking about the Tahoe Forest Health System Foundation, and we are going to come back in a moment here, and we're going to talk a little bit more about the foundation itself. We're talking with Harry Weiss, President and CEO of the Tahoe Forest Health System, and this is Mountain Health Today. I'm Ted Owens. We'll be right back. Watching Mountain Health Today. I'm Ted Owens, and we're talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. And today we're talking about the Tahoe Forest Health System Foundation. Harry, let's talk a little bit about the Veli's robotic-assisted solution. This was a wonderful act by the Board of Directors of the Foundation to make that happen. Tell us about it, how it happened, and what it is.
Yes, we're extremely pleased to have the latest technology robot assist knee replacement surgery device of any hospital within our region. And our Tahoe Forest Health System Foundation community-based board did kindly approve funding that great tool for our community. And it's a highly sought after tool. We're thrilled to have it.
And in addition to that, Harry, the board didn't stop there. The foundation board also has made generous gifts to the Gene Upshaw Memorial Tahoe Forest Cancer Center. Share with us a little bit about what they delivered there in the Cancer Center.
Yes, there we were able to purchase 9 Nemshoff Serenity recliner infusion chairs, and this would be especially for chemotherapy patients and other infusion therapy patients, which are very comfortable. They're very home-like, but they have all the features that are really helpful for infusion patients. We're just thrilled to have those.
My understanding also is they really don't have a clinical appearance. They're very much designed like something you might have in your home, right?
That is correct, and very comfortable, allows the patient to be much more comfortable than the older vintage of chairs that we had.
Harry, much of the support from the foundation to the Cancer Center has to do with a variety of services that are not covered by health insurance, correct? And what might those be?
We're happy to really have a legacy that helps our cancer center really stand out versus other full-service cancer centers. And we provide a wide array of holistic services, many of which are free for our patients. And these would include wigs, would include massage therapy, acupuncture, grocery or gas cards, as we have patients sometimes that come from a great distance to come see us. It also includes psychosocial services and maybe includes discounted hotel access as well.
But I also understand it has programs that might help with a patient in the application of makeup or wigs or things like that that you wouldn't ordinarily think about until you're actively going through treatment, perhaps, right?
That's correct. And all of these elements, even including dietetic counseling, are vital to really recovering, having the right mindset, the right nutrition, and the right health as a person is fighting cancer.
Well, I think it's wonderful, the donors that make this happen, as well as the community members that serve on the foundation board and guide and oversee it. Let's change gears just a little bit because you have another foundation in Incline Village, very important foundation that takes care of the Incline Village Community Hospital, and they do the same type of work, maybe in a bit of a different scale. Tell us some of their successes.
We're so excited that at Incline Village Community Hospital Foundation, they've been an amazing partner for the last 25 years with a long list of just huge capital need assistance. But we really have an amazing first for us as well, and that is the Helmsley Charitable Trust has recently granted Incline Village Community Hospital Foundation $1.8 million to really help us purchase a new 128 slice CT scanner and a new fixed x-ray device. Our previous CT scanner was just 16 slice, so we're really excited to begin the construction and related work to bring that on board.
So that equipment's state of the art.
Absolutely, it's the best that you can get and extremely rare in a small rural facility. And we're really grateful for the Helmsley Charitable Trust that they've really made it a priority to see how they could improve healthcare in very rural communities of Nevada.
But that really also takes a very functional and highly active board of the foundation, right?
That is correct. They're instrumental in really engaging and helping these kinds of end results happen.
Harry, tell us a little bit about how your not-for-profit health system continues to zero in on providing the most up-to-date equipment. You've told us a little bit about the assistance of the foundations. Do the foundations really make a big difference in your ability to attain state-of-the-art equipment?
Right, especially in a small rural community such as Incline Village. The strong philanthropic partnership is really vital. Approximately 1/3 of roughly 1,350 critical access hospitals in America are in dire straits or at high risk for closing in the future. And we're really blessed in this region to have a caring, very partnering community who is helping us with the capital needs, the equipment needs, the renovation needs, modern technology. And our team is really focused in on the operations. And this is what has allowed undisrupted great health care in that community to happen for the last 25 years, when it was very stressed and very up and down in the first 15 years of life of the hospital in Incline Village.
We've been talking about the Tahoe Forest Health System Foundation. To learn more about the different ways you can support the Tahoe Forest Health System through philanthropy, please visit www.tfhd.com/giving. We've been talking with Mr. Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, thanks for joining us. Really appreciate it.
Thank you.
And you've been watching Mountain Health Today. I'm Ted Owens. Thank you for tuning in.